Good day, dear student. Today we will have a lecture on discipline, prevention and communal dentistry. The theme of our lecture is prevention of non-carious lesions of the teeth, preventive component in therapeutic interventions in the oral cavity, preventive measures in pregnant women and infants. The purpose of the lecture: to study methods and means of preventing non-carious lesions, as well as dental diseases in patients with therapeutic interventions in the oral cavity, in pregnant women and young children. Relevance of the lecture: knowledge of the etiology of non-carious lesions, critical situations during dental interventions in pregnant women and young children, as well as the characteristics of methods and means for their prevention, will help maintain a high level of dental health and reduce the risk of complications. Classifications of non-carious lesions. Patrikiev, 1968. Dental lesions that occur in the period before teething. Enamel hypoplasia, enamel hyperplasia, endemic dental fluorosis, anomalies in the size and shape of the teeth, change in the color of the teeth, hereditary disorders of dental development. Second, damage to the teeth that occurs after their eruption, pigmentation of teeth and plaque, erasure of hard tissues, wedge-shaped defect, erosion of teeth, necrosis of hard tissues of teeth, injury, hyperesthesia. Enamel hypoplasia, from Greek hypo, reduction, and plasia, formation, as a result of metabolic disorders in the body of the fetus under the influence of impaired maternal metabolism or past diseases by the fetus, mother. As a result, violation of the secretion of the organic matrix by ameloblasts and its mineralization. Enamel prism, from 4 to 4.5 months of embryonic development. Enamel hypoplasia can be system and local. Systemic enamel hypoplasia is a valuation of the structure of the enamel of all teeth or a group that is formed at the same time. Temporary teeth, mother, toxicosis of the second half of pregnancy, infection of the diseases, rubella, toxoplasmosis, influenza, acute respiratory viral infection, chronic pyelonephritis, chronic chlorocytis in the degree of exacerbation, heart defects, metabolic disorders, diabetes, medication, tetracycline. Systematic enamel hypoplasia, temporary teeth, child history, prematurity, birth injury, fetal asphyxia, encephalopathy, hemolytic disease associated with the Rh factor, artificial feeding, blood transfusion of neighbors, congenital diseases of the cardiovascular system, And in picture we see spotting and erosive hypoplasia. Permanent teeth. The formation of enamel of permanent teeth begins at the end of fetal development. The cutting edge of the central incisor, tubercles of the first milk teeth. The main histogenesis after birth reflects the state of the child's body in the first year of life. Child. Infectious diseases, rubella, toxoplasmosis, purulent septic conditions, pneumonia, bronchitis, allergies, neurodermatitis, rickets, dyspepsia, valuation of the gastrointestinal tract, hypothyroidism, hypoparathyroidism. Permanent teeth. Chronic renal failure, cerebral palsy, damage to the central nervous system, congenital metabolic disorder, osteoporosis, iron deficiency anemia, Costello syndrome, Proteus syndrome, malnutrition, forms, spotted, speckled, bowl-shaped, furrowed, aplastic. Forms of dental hypoplasia. In this picture we see sputum form, erosive, furrowed, wavy, and aplastic. Local enamel hypoplasia. Temporary teeth do not operate. Permanent teeth. Damage to one or two or three adjacent teeth as a result of dysfunction of enameloblasts, as a result of case acting locally, mechanical trauma of the rudiment of teeth, impacted dislocation, infection of the jaw, periodontitis of milk tissue. And in picture we see wavy hypoplasia and aplastic. Prevention. Vaccination of girls and girls against rubella. Multivitamins for pregnant women. Breastfeeding. Full nutrition, timely treatment of infection and somatic pathologies in pregnant women and children, timely treatment of carious, pulpitis, periodontitis of milk teeth, injury prevention, sports, health education work. And in picture we see furrowed systemic hypoplasia. Fluorosis, temporary and permanent teeth. Limited, localized, systematic, generalized. With the toxic effect of high concentration of fluorides on ameloblasts during the development and formation of enamel and dentin. Factors: tolerance of the child's body to fluorine, individual metabolism in the body, food, sanitary and household, social, climatic, length of stay, heredity, from relatives, prevalence of dental fluorosis depending on the concentration of fluoride in drinking water. And we see fluorine content in water, milligram to liter. If we have 0.8 to 1 milligram to liter affected by fluorosis, from 10 to 12%. If in our water 1 to 1.5, it is affected from 20 to 30%. 1.5 to 2.5, it is affected from 30 to 40%. And over 2.5 milligram to liter, it is more 50%. Fluorosis endemic. High content of fluorine in the environment water. In surface aquifers 0.5 milligram to liter. In deep 30 milligram to liter and more. Endemic region, it is African countries. Industrial. Aluminum plants. Cryolite factories. Production of phosphate fertilizers. Production of insecticides and zoocides containing fluorine. Fluorosis iatrogenic. Greek iatros, doctor, genao create, produce, as a result of the mistakes of medical workers. Incorrect, carious action. Fluoridation of water, milk, salt, bread. Bottled sparkling water up to 4.5 milligrams to liter. Toothpastes. Preschoolers swallow up to 60%. Up to 5% is absorbed through the oral mucosa. Use of toothpastes with fluoride more 500 ppm by preschoolers, and long-term use of fluorine preparations. Fluorosis. Forms: dashed, spotted, chalky mottled, erosive, destructive. And degree of severity: doubtful, very weak, weak, moderate, and heavy. Fluorosis prevention. Collective methods: replacement of the water source, construction of water treatment plants for defluorination of drinking water. Individual methods of fluorosis prevention: replacement of drinking water, bottled, juices, and other. Nutrition: limit sea fish, animal fats, lamb, tea, and other. Fluoride-free toothpastes and rinses. Taking calcium-containing drugs, vitamins, mineral complexes after consulting a pediatrician. Removal of children in the summer from the endemic zone. Water defluoridation. Boil from 5 to 10 minutes and stand from 4 to 5 hours. Or you can do water freezing. Erasure of teeth is a physiological process that takes place throughout life. The degree of erasure and its speed are determined by the nature of the food and the intensity of the use of the chewing apparatus. Pathological erasure. The reasons: malocclusion, dentition defects, overload, improper design of prostheses, malformations of hard tissues of tooth, habit of chewing on one side, diseases of the endocrine system, thyroid gland, parathyroid gland, pituitary gland, hormonal metabolic disorders in women. Physiogenic reasons: bruxism during sleep, frequent, strong, prolonged contact of teeth, knocking, gnashing of teeth during stress. Abrasive reasons: exposure to toothbrushes, toothpastes, food, very hot food. Professional factors: exposure to dust, beating of trees with teeth, glass blowers. Bad habits: the formation of a pattern on the incisors from the mouthpiece, pipe, clicking seats. Wedge-shaped defect: these are cervical defects of the teeth. Right-handed people tend to be on the left, left-handers tend to be on the right. The shape of the defect in the longitudinal section of the tooth resembles a triangle wedge with a smaller size in the area of the crown. Etiology: mechanical load, abrasive factors, hot toothbrushes, toothpastes, improper brushing of teeth, loads in the region of the neck of the tooth during bending of tension, abrasion, with periodontitis. Marker of hormonal and metabolic disorders in women: decrease in estradiol levels, development of osteopenia and osteoporosis, with physioneurotic diseases, neurosis, depression, schizophrenia, diseases of the thyroid gland, pituitary gland, gastrointestinal tract, height acidity. Erosion. This is a progressive, insufficiently clarified etiology. The loss of enamel and dentin on the vestibular surface of the teeth, more often the upper jaw. Etiology. Excessive consumption of acidic juices, citrus fruits, products containing citric, acetic, malic acids, carbonated. Taking acid-containing medicines, vitamin C, aspirin, iron supplements. Work in the chemical industry. Somatic pathology. Disease of the thyroid, hyperfunction, and parathyroid hypofunctional glands. Changes in the composition, properties, and secretion of saliva. Increased secretion, decreased viscosity, and remelaxing function. Dysfunction of the gonads, estrogenia, diseases of the gastrointestinal tract, gastritis with high acidity, vomiting, regurgitation, genetic factor. Necrosis of hard tissues of teeth. Against the background of dysfunction of the endocrine glands, the central nervous system with chronic intoxication of the body, hyperthyroidism, radiation, post-radiation necrosis, acid, chemical necrosis of hard tissues of the tooth, computer necrosis. Radiation necrosis. Enamel change caused by irradiation in connection with the treatment of malignant tumors. Occupational hazards. Prevention. Making an individual lead mouth guard put on before irradiation. Chemical necrosis. Prevention. Supply and exhaust ventilation in workshops. Device columns with alkaline water for rinsing the mouth. Prophylactic remineralizing therapy. Traumatic damage to the teeth. Acute trauma to the tooth. Chronic tooth trauma. Cases of acute trauma to the tooth. Fall, household. Hit with various objects. Sports, dance. As a result of medical procedure. Cases of chronic tooth injury. Prolonged exposure to a traumatic factor. Bad habits. Smoking pipes. Mouthpieces. Seeds. Nuts. Professional factors. Tailors, glass blowers, orthodontic, orthopedic constructions, overestimating feelings, pathological bite. And in this picture we see chronic trauma. Hyperesthesia of the teeth. Hyperesthesia, increased sensitivity of tooth tissues to mechanical, chemical, and temperature stimuli. Factors that influence the occurrence of hyperesthesia. Gum recession. Apical displacement of the gum edge, accompanied by exposure of the neck and root of the tooth. Periodontitis. Violation of occlusion. Anomaly of the frenulum of the lips, small vestibule of the oral cavity, pronounced strength of the mucous membrane of the lips and cheeks, violation of the technique of brushing teeth, toothbrush, toothpaste, dental floss, toothpicks. For dental treatment. Loss of hard tissues of tooth. Lack of enamel, aplasia. Carious. Non-carious lesions. Erosion. Abrasion. Wedge-shaped defects, trauma, violation of hygiene care, toothbrush, toothpaste, tooth powder, toothpicks, cleaning technique, bruxism. Factors that influence the occurrence of hyperplasia. Iatrogenic. Preventive hygiene. When filling with composite materials. Mistakes in orthopedic and orthodontic treatment. Galvanism. Teeth whitening. Food and drugs. Products with low pH. Medications. Hyposalivation. Low buffer capacities. Prevention dental diseases in patients during medical interventions. Orthopedic construction. Risk factors for dental diseases. Retention points. Accumulation of plaque. Lack of care skills. For the oral cavity, prosthesis. Candidiasis, stomatitis. Prosthetic Hygienic Index 1982 determines the amount of plaque on a removable denture. Remove the prosthesis from the mouth, immerse in a container of water for 1 minute to remove food debris. Paint the prosthesis with erythrosine solution. Leave for 1 minute. Rinse the denture under running water. Wash off loose dye. Estimate. Before coloring we see prothesis and after coloring. 0 it is no plug. 1 thin layer up to 25% of the surface. 2 that is moderate amount from 26 to 50%. 3 plentiful from 51 to 75%. And 4 very abundant, more than 75%. Index of assessment of the hygiene condition of removable orthopedic dental construction with partial absence of the teeth. DHI. Kuzmina Ibragimov, 2012. Paint the inner surface of the prothesis with 5% erythrosine solution. Rinse with water for 5 seconds. Air dry for 10 seconds. Photograph surfaces. Apply template. Transparent plastic. 0 it is no staining. 1 slight staining. 2 staining less than 1/2 of the segment's surface. 3 staining more than 1/2 of the segment's surface. And 4 painting the entire surface of the segment. Calculation the index DHI. Sum of segments chords divide to number of the segments. From 0 to 1.5 points it is excellent. From 1.5 to 2.5 points it is satisfactory. From 2.5 to 4 points unsatisfactory. And in this picture we see denture care tablets and how it use. We drop it in the water, then we drop prothesis and wash prothesis. Compound: oxidizers, carbonates, chelates, detergent. And how with dental care brushes. Use dental care brushes. Dental care paste. Care of dental prothesis from dental floss. Care of dental prothesis, professional cleaning. Care of dental prothesis, ultrasonic disinfection bath. Care of dental prothesis, oral irrigation. Prevention of dental diseases in orthodontic treatment. Changes in dental status. Dental deposits. Enamel demineralization, carious. Inflammation of periodontal tissues. halitosis. Modified complex index MCI by Kuzmina 2005 determines the level of hygiene and condition of periodontal tissues in patients with non-removable orthodontic equipment. Staining with iodine solution. Plaque assessment. 0. No plaque on the teeth and bracket system. 1. Plaque on the bracket system. 2. Plaque on the bracket system and teeth. Evaluation of the gingiva. 0. No gingival inflammation. 1. Inflammation on the gingival papilla. 2. Inflammation on the gingival papilla and marginal gingiva. Calculation. Sum of plaque counts per tooth. Divide per number of teeth. Then sum of gingival inflammation codes for each tooth. Divide per number of teeth. Then the sum of 1 and 2. From 0 to 0.5 points it is good. From 0.6 to 1.2 points it is satisfactory. From 1.3 to 4 points it is bad. Prevention of dental diseases in orthodontic treatment with brushes. Bracket care superflosses. Superfloss threads, at first narrow and thin, the middle part voluminous, defibrated, for cleaning dental structures or removing exudate from the periodontal pocket due to good absorbed properties. At the end, a regular tape for removing plaque from the interdental spaces. Bracket care flosses. Care of the bracket system irrigation. Bracket care rinse aids. Bracket care professional care. Prevention of dental diseases with implants. Changes in dental status. Peri-implantitis. Risk factors. Poor oral hygiene. Periodontitis. Smoking. diabetes, alcohol abuse. It is not recommended with implants. Toothbrushes with even trimming bristlets, rinses containing alcohol, toothpicks, chewing gums. For oral hygiene with implants, irrigators, professional hygiene, removal of dental deposits from the surface of implants using plastic and Teflon curettes, implacers. Antenatal prophylaxis dental diseases. Development of dental anomalies in the antenatal period. Congenital risk factors. Genic predisposition. Association of genes of the H1A system. Hereditary factors. Lack of rudiments of teeth, primary addentia. Lateral position of the incisors. Micro and macrognathia. Supernumerary teeth. Prognathia or retrognathia. Anomalies in the size and attachment of the frenulum of the tongue. Congenital nonunion in the maxillofacial region. And in this picture we see supernumerary teeth, tongue frenulum anomaly, and micrognathia. Acquired risk factors associated with impaired pregnancy and maternal health. Viral diseases, gynecological pathology, fall or injury, taking antibiotics, salicylates, sulfonamides. Alcohol intake and smoking of parents. Malnutrition, unbalanced nutrition of a pregnant woman. Stress in the first trimester of pregnancy. Harmful preventive factors. Work with varnishes, paints, chemical solvents. Mechanical injury in the antenatal period. Deformation of the jaw with prolonged pressure on the fetus of excess amniotic fluid. Physical activity, sport, walk. Tight clothing. Excess nutrition. The hands of the fetus are pressed to the face, the chin to the chest. As a result, micrognathia, facial asymmetry, and other. Mechanical injury in birth assistance. The imposition of forceps on the head of the fetus. The likelihood of damage to the temporomandibular joint and the formation of ankylosis. Underdevelopment of the lower jaw. Factors increasing the risk of dental diseases in pregnant women. Decrease in the pH of the oral fluid, hyposalivation. Decrease in saliva calcium and phosphate. Change in diet. Snacks, refined carbohydrates, lollipops. Increased in female sex hormones, gingival hyperplasia. Change in the immune response, violation of the balance of the microflora of the oral cavity. Increased the number of periodontogens. Algorithm of dental reception of pregnant woman. 6 to 8 weeks pregnancy. First dental examination. Professional hygiene plus selection of hygiene products. Health education. Appointment of vitamin complex. From 16 to 18 weeks pregnancy. Second dental examination. Professional hygiene plus correction of hygiene products. Health education. Vitamin and mineral complexes. Exogenous remineralizing therapy. And those we do in 26 from 28 and 36 to 38 weeks too. Second trimester from 13 to 24 weeks. It is optimal for oral sanitation, medical manipulation with pregnant women. The ability of the dentist to influence the patient's somatic health is limited. Dentist must be able to assess the attitude of the patient to his health, give competent recommendations adequate to the age and conditions of the patient. Pay special attention to risk factors above the prevention. Focus on fulfilling the appointment of an obstetrician gynecologist to form a healthy lifestyle for the patient. Motivate to visit the dentist in the first year of a child's life. Postnatal period development of pathology of the maxillofacial region. General factors. Diseases of the child, including those leading to mouth breathing. Features of the development of the child. Postural states. Background pathology. Prematurity. Birth trauma. Rickets. Endocrine pathology. Adrenal glands. Thyroid and parathyroid glands. Pituitary gland. Dysplasia. Diseases of the respiratory and musculoskeletal system. Muscular dystonia, and other. And in first picture we see dysplasia of the bones of the face. Rickets, modification of the development of the bones of the skull. Mouth breathing, deformation of the dentition and jaws, violation of occlusion and chewing. Pathogenesis, the role of air jets that normally pass through the nasal cavity and stimulate the growth of the upper jaw in the region of the median palatine suture. Second, imbalance in the activity of the muscles of the maxillofacial region in the absence of nasal breathing. The reasons. The first, violation of the patency of the nasal passages in chronic diseases of the throat, nose and ears, adenoids, polyps, divided septum, and other. Second, violation of the function of external respiration as a result of bronchopulmonary diseases. Third, wrong stereotype of breathing as a result of frequent acute respiratory viral infection. 4. Cold injury of the airways. Response defensive reaction. Abundant rhinorrhea and other. 5. Violation of the closure of the lips as a result of functional insufficiency of the circular muscle of the mouth, pathological occlusion, anomalies of the frenulum of the upper lip, and other. Natural feeding. Factor in the formation of the dentoalveolar system of an infant. Normally, when feeding a child, a large load on the masticatory and facial muscles should be created. This stimulated the growth of the lower jaw, which at birth length behind the upper jaw by an average of 1.5 centimeters. With artificial feeding from a bottle, The child makes less effort and the muscles of the lower jaw do not receive the necessary functional load for growth. Recommendation for artificial feeding. The nipple should correspond in shape and elasticity to the nipple of the mother's breast. The opening of the nipple is positioned so that the jet of the mixture is directed to the hot palate, simulating the natural. Recommendation for artificial feed. Providing conditions for active sucking, catching and holding the nipple with the lips, moving the lower jaw to squeeze out milk and swallow it. The position of the child in the arms corresponds to that of breastfeeding. For artificial feeding, the bottle should not put pressure on the lower jaw, as this will cause the lower jaw to move backwards and change the shape of the lower jaw. The bottle is held perpendicular to the baby's face. Do not leave the bottle in the hands of a child unattended. The duration of feeding is an average of 20 minutes. Timely transition to feeding from a spoon. Completely abandon the bottle by 1 year. Since the sucking reflex fades by 1 to 10 months. Nipples. According to the material of manufacture, latex and silicone. The size of the nipple and its parts, depending on age. The shape of the nipple, including orthodontic. The shape and size of the holes, small, medium, or large, round, oblong, X-shaped. Dumps. See specifications. Posotonic status. Posotonic postural reflexes. Habitual sitting position. The usual position of a lying person is on the back on the side, on an elastic hard mattress, to prevent deformation of the spinal column, on a low pillow. With such a distribution of gravity, muscle traction and pressure, the lower jaw occupies a position corresponding to the physiological bite. The emerging bones of the maxillofacial region experience optimal loads. Postnatal period development of pathology of the maxillofacial region. Local factors: bad habits, destruction of crowns of temporary teeth, premature removal of temporary teeth, infantile type of swallowing, anomalies in the development of the frenulum of the lips, tongue, insufficient physical abrasion of tubercles of temporary teeth, inflammatory diseases, neoplasm, injuries of the maxillofacial region. Bad habits: sucking, beating fingers, tongue, lip, cheeks, objects. Persevere after 1 year. Correction: children's neurologist and orthodontist. Premature removal of teeth. Effects: displacement of neighboring teeth, anomalies in the eruption of permanent teeth, chewing dysfunction, anomalies of occlusion, change in the physiological state of the child, violation of swallowing and diction. Infantile type of swallowing. Effects: vertical incisal disocclusion, with natural feeding in the oral cavity negative, pressure in the mammary glands positive, active contraction of the circular muscles of the mouth leads to the opening of the openings of the nipple and milk enters the oral cavity. When swallowing, the tongue is located between the gingival ridges. Milk flows into the oropharynx, starting from the labial and buccal muscles. The tongue includes the rest of the muscles in the act of swallowing. Somatic type of swallowing. The incisors have cut through. This is the support of the tip of the tongue. The tongue is between the gingival ridges. There are no lateral teeth. The lateral teeth erupted. The fulcrum of the tongue, the upper teeth and the anterior part of the hard palate. Introduction to the diet of solid food. The extinction of the sucking reflex by 10 to 12 months. Effects: it is the vertical incisal disocclusion. Anomalies in the development of the frenule. Shortened frenule of the lip, it is diastema. Localized periodontitis. Reconfiguration of the lip. Shortened frenulum on the tongue. Dysfunction of sucking. Eating disorders. Respiratory failure. Violation of diction, growth retardation of the lower jaw, anomaly in the position of the incisor of the lower jaw, localized periodontitis. Thank you for your attention. That's all for today. Goodbye.